Secretary Anya joins us live this morning. Good morning, sir, and thank you very much for joining us.
Good morning, Christian. Good morning to our listeners and televiewers.
Okay, before we talk about the case of Cebu City, let's talk about this alarming data coming from the World Health Organization. The Philippines recorded the fastest increase over the past 2 weeks in terms of new COVID cases in the Western Pacific region. What are we doing? What are we doing wrong here? What's the problem? Are we actually taking control of this infection?
Yes, as we increase our our testing capacities, actually we expected that more positive will turn out. But if we will look at the positivity rate, we are about 5 to 6% positivity rate. Our target is to go down to 3% and probably to 1%. Now, I think it's not also fair to compare with Singapore because Singapore is a very small country, small population. If you look at per population of 100,000, they have about 41 per 100,000, while we have about 7 point something per 100,000. So we are still doing okay, even way below global average.
Okay, but of course, if we're going to talk about just the cases here in the Philippines, of course, you cannot avoid people from thinking that after 100 days of quarantine, we're still experiencing this big increase and this fast increase over the past 2 weeks. So what's wrong here?
Well, if you can look at the figures, most of these positive cases, new positive cases, are coming from particular regions, Region 7, National Capital Region, and now Region 8. But for the rest of the country, we're doing good. In fact, most of the countries now are under MGCQ. And some are even MDCQ with low risk, meaning to say they are near to the new normal. But of course, it's hard to put an area into new normal because we have people going around, and unless we are able to really achieve zero cases for at least 28 days for a particular area, then we can say it's going really to new normal.
But did the quarantine measures actually work? The fact that we're placed for quite a long time under ECQ, and then eventually that had to be relaxed.
Well, if you look at the projections of research groups, if we did not put the country, or particularly Luzon, under lockdown, we might have an infection of about 3 million and about a death of 100,000 people. So you see, we are doing good compared to other countries like United States, Brazil. So somehow we are able to contain in the whole country. But of course, National Capital Region and Cebu, we have to do more. Particularly in Cebu, it's now we call it's the epicenter now. It's compared to Metro Manila into area and population. Cebu has new 131 cases yesterday. So we have to do a lot of effort in Cebu.
So Cebu City is now the new epicenter?
Yes, more likely because of the rate of infection in Cebu City, just one city. So if you compare it to the National Capital Region, where we have 17 LGUs, for the new cases, we have 200. In Metro Manila, we have 356, while 131 in Cebu City. So you can just see the number.
Okay, just to be clear, when you talk about the new epicenter, you're just referring to Cebu City, or are you also referring to the entire province?
We're referring to Cebu City. Cebu City is getting a lot of new cases, and we are worried on the number of deaths also. So that's why we put up a task force in Cebu led by Secretary Simato, as directed by President Rodrigo Duterte, and we are sending more people, experts in Cebu City. In fact, this Wednesday, several members of the IATF will be going to Cebu again, together with Secretary Mark Villar, to look for more sites where we can put isolation or quarantine facilities. It is very important that we extract the positive out of the community and put them in the isolation facilities. We took note that most of the infection in the community are because many of our positive patients are undergoing just home quarantine.
Okay. So that's one of the reasons that you identified. Many of the positive cases were placed only under home quarantine.
Yes, out of the almost 4,000 cases, about half are actually under home quarantine. And you cannot be assured of those patients if they're really observing the proper protocols of home quarantine. So better to extract them out of the community to ensure safety of the families and also, of course, the neighborhood.
If I'm not mistaken, that was also one of the options available to the local government, right? That you can place them under home quarantine if they are very mild cases, if they're not showing any symptoms. Is that correct?
Well, if you really have a very good quarantine facility or home or room in your house, but if you are living in a highly dense community, it's quite very hard to impose or to implement home quarantine. So better to just like what we are doing here in Metro Manila, we built a lot of mega treatment and isolation facilities. So we are able to separate immediately those positive, mild, and asymptomatic patients.
So from now on, what is the direction as far as Cebu City is concerned? Every
But
single positive confirmed case would be placed under a quarantine, which is not a home
yes,
quarantine. That is the new direction
yes,
now.
yes, and we have started already since last week, and then secondly we are adding new health workers to Cebu City through the DOH. In fact, yesterday the DOH sent 32 health workers, and they're broken down into 9 doctors, 10 nurses, and 13 aidmen, and more will be coming. And of course, we will build more isolation facilities. The armed forces and the PNP will continue to implement the strict uh, observance of lockdown, and we also would like to enjoin and uh, ask the people to observe the health standards protocols. There are so many people violating the quarantine protocols, not wearing masks, not observing physical distancing. In fact, there was even a fiesta celebration the other day
Mm.
in Basak, San Nicolas. So we are going to file cases against the organizers for violating this quarantine protocol.
Are you filing cases only against the organizers or also against the local officials who have jurisdiction over that area?
The barangay captain and the police officer supervising that particular area, meaning the head of the police community center that has jurisdiction over the barangay, will be made to explain also.
Now, of course, this was also floated or mentioned by President Duterte last week, complacency. So this is really one of the reasons why there's a sustained community transmission in Cebu City. People are complacent.
Complacency and the eagerness to resume economic activities immediately. And of course, there are also LSIs. Cebu is one of the center of our country in terms of what you call that activities, economic activities, and as well as the hub for going to different areas. So there are so many LSIs, Ws that also arrive at Cebu. So those are the factors. And of course, in terms of the attitude of the people, there is the tendency to keep or hide the fact that they are infected, and they will only go to the hospitals when it is already too late, when they have severe difficulty of breathing. So that's why you can see in some hospitals patients die in a matter of 48 hours or even before arriving the ER.
Okay, so these are the reasons that you've cited so far on why there's a sustained community transmission in Cebu City. Number one, home quarantine for a lot of those positive cases, lack of discipline and complacency, and of course, How about the fact that local officials are also equally to blame for not strictly imposing what was supposed to be a very stringent quarantine measure in the previous weeks or months?
Well, in fairness to our local government officials, they're also doing their share. In fact, in the early days, Cebu had imposed the strictest quarantine procedure. It's very hard to go to Cebu, even to cross borders. But when we started loosening the classification, the people are too eager, and probably the LGUs were overwhelmed. That's why we have to help the LGUs. Mayor Labella is very cooperating or very cooperative, and he has already imposed a lot of measures and provided assistance to the constituents. Remember that there was a time that the city government issued 250,000 quarantine passes. There are only 99,000 households or families, and you have 250,000 quarantine passes, then as if there is no quarantine at all. So what we did is canceled all those quarantine passes and then just allowed only persons authorized to leave the residence, and likewise give one quarantine passes for every family.
Okay. Now, during the time when many of the positive cases were allowed to go on home quarantine, did it also mean that many of the isolation facilities were left unused, or most of all of them were used? That's why many of the positive cases were asked to go on home quarantine.
Well, actually, that was one of the what you call the loopholes that we saw. There are many isolation facilities, but they are not full. In fact, some are empty because it's more convenient to stay at home quarantine. But the problem is you are infecting people in the community. So now that's the one of the efforts that we are imposing now or implementing. Make sure that all positive patients, asymptomatic and mild, should be placed in the isolation facilities. Likewise, we would like to decongest hospitals. Those with just mild symptoms should be brought to the step-down facility, which is also an isolation facility. Okay. So we only want all those severe and critical cases to be at the hospital. Now, also Vicente Soto Memorial Medical Center is the designated COVID hospital. And we're thinking of the Talisay District Hospital to be another COVID hospital. So magpo-focus lang sila yung hospital to sa mga COVID patients.
Okay. Finally, Secretary Anyo, so is it correct to say that somehow, because many of the positive cases were allowed to go in home quarantine, many of them ended up as silent spreaders of the virus during that period? And number two, are you going? Can we expect the deployment of more military troops in Cebu City in the coming days or weeks?
Right now, I think we have enough forces now. Some of the reinforcements from Luzon already arrived at Cebu City, and we are now also employing drones to watch over the city for to apprehend violators, and it's very, very effective. The entire Cebu City, we have drones flying all around.
Okay. So, of course, the other question is that many of them ended up as silent spreaders. Is that correct?
Yes. That's why we are asking the public, the Cebu constituents, to please do your part. Observe health standards strictly, and likewise for those who are those who might have been exposed to positive COVID patients, please volunteer and move forward and go to the isolation facilities or have yourself tested. It is really very important that everyone will cooperate in this situation in Cebu City.
Okay, Secretary Eduardo Anyo, thank you very much for joining us this morning, sir.
Thank you very much, Christian, and good morning to everyone.